patient with hypersecretion of the gastric juices was recommended to exclude from the diet concentrated bouillons and vegetable decoctions because of their stimulation of gastric secretion. What is dominating mechanism of stimulation of secretion in this case? Gastrin stimulates the production of gastric juice in parietal cells. Stomach parietal cells release the G factor, literally called G cells. They stimulate gastrin production, and since it's the stomach, G cells produce gastrin. The answer is the stimulation of gastrin production by G cells. A person felt thirsty after staying in the heat for a long time. Signs of what caused it? When you stay in heat for a long time, you feel dizzy. We call the receptors that can identify this phenomenon osmoreceptors. Osmoreceptors detect the osmolarity of the body. If you have too much salt in your body, it makes the hypothalamus secrete chemicals that make you feel more hungry, so you drink water to get rid of the osmolarity. So the answer is osmoreceptors of the hypothalamus. An individual is characterized by a rounded face, a broad forehead, a Mongolian type of eyelid fold, flattened nasal bridge, permanently open short neck, flat hands, and stubby fingers. What diagnosis can be given to the patient? What are you thinking about this person? Every single bit of the features here is actually describing trisomy 21 or Down syndrome. Purulent endometritis developed in a woman after delivery. Treating with the antibiotic inhibitors of murine synthesis were ineffective. Wide-spectrum a bactericidal antibiotic was administered to her. In 6 hours, the temperature with a shiver, I quickly increased it to 40 degrees. Muscle pains have appeared. BP dropped to 70/40ths of a millimeter Hg. Oliguria has developed. What was the main reason for the development of this condition? So, first of all, they told you that she had widespread endometritis and that the antibiotic wasn't working. After 6 hours, even though antibiotics were given, the person still has a fever and is in shock. This is called septic shock, which is also what this person is going through. Septic shock is the result of an infection. Because of a serious infection that comes about from the endometrium, septic shock can also be called endotoxic shock. So the answer is an endotoxic shock. Secretion of gastrointestinal hormones is primarily decreased in patient with a removed duodenum? No duodenum, so what hormones or enzymes? Duodenum produces the hormones cholecystokinin and secretin, hence, A 2-year-old child experienced convulsions because of lowering calcium ions concentration in the blood plasma. The function of what structure is decreased? The parathyroid gland makes calcium, so if it can't do its job, calcium could be very low. Low calcium can cause rickets, vitamin D deficiency, convulsions, numbness, arrhythmia, tetany, and all of that. So the answer is parathyroid glands. While emotional excitement, the heart rate in a 30-year-old person runs up to 112 beats per minute. What part of the conducting system of the heart caused it? If it's between 60 and 80, we're looking at the cyano-arterial node. Between 40 and 59, we're looking at the atrioventricular node. Between 20 and 39, we're talking about the His bundle. Below 20, we're talking about the Purkinje fibers. If the person is emotionally excited, it could be more than 80. During exercise, the SA node beats faster than usual, so your answer is the sinoatrial node. Usage of oral contraceptives with sex hormones inhibits the secretion of the hypophyseal hormones. Secretion of which of the indicated hormones are inhibited while using oral contraceptives with sex hormones? We know that contraceptives are used to control births, so they want to know what this hormone actually does to prevent a child or fetus's formation. So basically, what contraceptives do is inhibit the release of what's called luteinizing hormone. When this luteinizing releasing hormone is inhibited, it will suppress the level of follicle-stimulating hormone, which stops the growth of ovarian follicles. Hence, the release of the egg will not be possible. During the breakout of acute respiratory infection, in order to diagnose influenza, the express diagnosis, based on revealing of specific viral antigen in the examined material, nasopharyngeal lavage, is carried out. Which reaction is used for this? So, if we have a viral infection, which method is used to identify a specific viral antigen? Immunofluorescence is a lab technique that uses antibodies chemically conjugated to fluorescent dyes to photosynthesize. If you are not a lab technician, you may find it difficult to understand. However, because the question asks what to do for a specific viral antigen, the answer is immunofluorescence. A 38-year-old woman was admitted to the admission diagnostic department with uterine bleeding. What are the most likely changes of blood? So, there is bleeding, and sometimes when there is blood loss, it means that the person will breathe less. This is because when there is blood loss, the person will have less blood in their body, and the ratio of the volume of the red blood cells will change, and the answer is a reduction of hematocrit rate.